So, good evening, everyone. A very, very warm welcome to all of you. I'm sure you're joining us today from different cities, and everybody is very curious to know about how to prevent falls, which is, I think, a very, very common concern among seniors. And we have known of so many, situations where somebody has had a fall and had to deal with a lot of issues because of that later on. So how can we really prevent falls, right? And that is why we are all here today, and we are very thankful to Dr. Arvind Kasthuri to be here today with us to be conducting this talk. But before I hand over to him, a very warm welcome to all of you from the Silver Talkies team. I represent Silver Talkies team. I'm the co-founder of Silver Talkies, and we are a social impact organization which has been working exclusively for seniors and with seniors since 2014. And the idea behind Silver Talkies has been to promote active aging. And when I say active aging, it primarily just not, it doesn't only pertain to your physical and mental health, but also your emotional and social health, right? So how do we ensure that your physical well-being, your mental and social well-being, emotional well-being is taken care of? So we do have different service lines that we have. We run a very active community of older adults, people who are above the age of 55. And these are all people who really think age is a number, and they love to treat their lives very well. They like to have fun, and they like to interact with others. So so their social life, if I may call it so, is really active and happy. And if that is something which you would like to be a part of your life, I invite all of you to join us at Silver Talkies Club, which is a very close-knit community of older adults. And what we do as part of this club is not just that we as a team organize events or create fun and entertainment for them, but even the members themselves participate in a lot of activities. They run quizzes for each other. They share their knowledge with each other, be it running spiritual sessions, meditation sessions, or sharing. Even we have members who have spoken to others about food preservation techniques. So, and they'd share their nuggets on gardening tips and all. So yeah, so there is a lot of camaraderie, there is a lot of rapport, there is a lot of knowledge sharing and interaction which comes through the club. So I invite you all to become a member. Since it's all virtual, you can join us from any city. We currently have members from, I think, about 8 or 9 different cities in the country, and also from Dubai and US. So wherever you are from, you're most welcome to be here. And you can also catch up on a lot of this kind of information that you are here to listen to today, like fall prevention and other relevant topics, on our magazine, silvertalkies.com. So we do have a lot of experts like Dr. Arvind Kasthuri who help us out with these articles. They give us information, they give us gyan, and you would find a lot of other interesting information on our website. So do check us out. Now, without further ado, let me invite our guest of honor today, Dr. Arvind Kasthuri. I have met Dr. Arvind Kasthuri a couple of times, and it has always been a pleasure to interact with him. He's so passionate about working with seniors and for seniors. He's a professor of community medicine, and he is the mentor for senior citizen health services at the Department of Community Health, St. John's Medical College, Bangalore. And he actually has been with St. John's Medical College since 1993, and he developed an interest in the health of the elderly, and he launched this health service in 2005. And so much so that currently they run geriatric clinics in the rural area for the rural folks. They run institutional support services. They have village senior centers and home health services in areas in and around Bangalore. And recently, the service won the Indian Association of Preventive and Social Medicine Award for Best Practice in Community Medicine. So currently, Dr. Kasthuri is leading an effort to establish the unique St. John's Geriatric Center, which is going to be one of its kind comprehensive facility for care, training, research, and community engagement in geriatrics on the campus of St. John's. Now, when he's not busy with his work, he also loves, he has a love for music, and he's part of the Cause Foundation and the Kiara Academy of Performing Arts, where he promotes musical theater in Bangalore and Mangalore in support of charitable causes. And recently, he was also part of the TEDx platform where he gave a talk on the other thing you do, which was very well appreciated and is now available on YouTube. So, whenever you have time, do hear him out, and I'm sure you will get to learn a lot from his experience. So a very warm welcome to you, Dr. Kasthuri.
Hello, hi Nidhi, and hello everybody at Silver Talkies. It's a real pleasure to be with you. Thank you for those very kind words, Nidhi. I think you can, on the screen at least it looks like I'm blushing. I'm not sure if that's the lighting or it's actually happening. But thank you very much for those kind words of introduction. It's a pleasure to deal with this community, like you say, of seniors who are very actively and I must say successfully aging. It's a pleasure always to interact with all of you. Like she said, like Nidhi said, I am involved with the health of seniors in a service that we call the Senior Citizen Health Service. And it is with that background that I come into this session today. So I have titled this talk, Prevention of Falls in the Elderly, because that is the topic that all of you have come to understand a little bit about, perhaps from the kind of experience that we have had dealing with senior citizens over these past 15 to 20 years. So when we say falls, I did a diploma in geriatric medicine after I did my MD in community medicine. And falls is called a geriatric syndrome, simply because it is fairly common in elderly people and it has multifactorial reasons why it happens. And it's a very, very important problem for those aged 60 and above. So today, I thought I'd start by telling you that, at least putting into context how important this issue is. Now, this is a World Health Organization statistic that you're seeing on the screen. The WHO estimates that 28 to 35% of older adults experience a fall each year. Now, that's almost 1 in 3 people. And we also know that the incidence of fall increases as we age, which means that the risk of a person having a fall increases as you grow older. And that is a graphic on the side from a Canadian study. I have taken the liberty of borrowing a few facts and figures from a few research studies so that we understand what is happening, not just locally, but globally as well. Now don't bother about trying to read the text. I can't myself. It's just the shape of the graphic that I'm drawing your attention to, where you will see that the incidence of falls on the axis on the bottom is age, and those red and blue bars are the incidence of falls, and on the side you'll see the percentage. As you see, from 65 onwards, these are cut into 5-year gaps, 65 to 69, 70 to 74, and so on. The incidence of fall actually rises to almost more than 40% above people 70 years of age. Now, many falls result in minor injuries. That's a great thing. But some falls can result in serious injury. And that's the problem. And that's perhaps why we are having this session today, where we are talking to a group of enlightened seniors about what we can do about this problem of falls among senior citizens. So the outline of today, I thought I'd try to answer these 5 simple questions. We'll start by understanding what we mean when we say fall, though I know intuitively all of us know what a fall is. Then we will ask this question of why do elders fall? What are the reasons why a senior citizen should fall? Then what happens or what can happen when an older person falls? And perhaps for those caregivers who are also part of this session, and for ourselves, our seniors themselves. What should we do when either we fall or somebody we are looking after falls? And finally, the topic of today, which is how do we prevent falls among older people? Off with what is a fall? I mean, it's a very intuitively simple question. So I thought I'd share a small video clip. Now, let's see if this works with all of you. Now, this is a video clip. I'm going to show it. And never mind if you cannot get it the first time or can't hear, I can even play it again. I'm going to play only a few seconds. It's a long video clip, but I'm going to play only a few seconds for us to understand. Let's have a look. So a fall is defined as this, an event which makes you come to rest inadvertently on the ground or at a lower level. Now the word here, the critical word, is inadvertent, which means that if you actually want to go and sit on the ground for whatever purpose, that's not a fall, obviously. But coming to rest inadvertently, now you saw what happened in that clip. Now that gentleman felt that he could do it, he could walk, but unfortunately, he probably didn't see something, he didn't hear something, and he inadvertently came to rest at a much lower level suddenly. And that is the definition of the term fall. So what is a fall? A fall is an event where you come to rest inadvertently on the ground or at a lower level. So that's our first question. Now, why do older people actually fall? Now, for this, let me read to you a small case vignette, a small case story of a person who came to hospital. Now, this is, let us call her Mrs. X. She's a 75-year-old lady, and she visited the hospital to see the doctor. We are answering the question, why do older persons fall? Mrs. X is 75 years old. She visited the hospital to see the doctor. And she has tremors, she has high blood pressure, she has diabetes, and she's finding it difficult to walk, and occasionally her knees ache. So that's Mrs. X. So she visited the hospital. She saw the doctor, and the doctor said she was doing well. He changed a bit of her medication, gave her a prescription, and she leaves. And then, unfortunately, Mrs. X had a fall. Now, this is a situation which can happen in a healthcare setting. It can happen in a home setting. It can happen in a public setting. The question we are asking is, why did Mrs. X have that fall? It could be because of several reasons. One, she walked ahead, but she didn't see the step. So she fell. She walked ahead, and there was a small step there, just like perhaps in the clip. The man thought he could do it, and as he walked ahead, he didn't see a small step, and he had a fall. In fact, when that was about to happen, somebody shouted out from behind, "Madam, be careful." But she didn't hear. And she didn't hear, she didn't see the step, she tripped and she fell. Of late, she says she's finding it difficult to hold tightly onto the railings. This is a complaint that she has even at home. Many of our other people in our families, the older persons we look after, find it difficult to hold tightly onto something many times, perhaps because their muscles have become weak with age. On top of which, she says, her knees sometimes don't bend like she would like them to bend or buckle when she least expects it. Perhaps she has a little arthritis in the knee. And that perhaps could have contributed to the fact that she fell. She feels, in fact, that she's becoming unsteady even while walking within her house. Now, how many of us, how many of the people you look after, how many of the people in your house, the older persons tell you, listen, of late, I'm not that steady when I walk, even inside the house. Unsteadiness. Okay? Her daughter has been telling her she should use a walker, but she feels it is not yet time. She feels, come on, walkers are for really old people, not for me. A stick, for example, no, not for me. It's for somebody perhaps who needs it, but I don't yet need that. She hasn't been using a walker, she hasn't been using a stick. Perhaps that would have prevented her having a fall. The hospital corridor has been freshly swabbed, and this is where sometimes we goof up in the healthcare setting. The floors are wet. The mop has been left on the floor. She didn't see it. She tripped on it and she fell. The doctor has changed her medications. In fact, that is because she said, the previous one is making me feel a little sleepy in the mornings. And perhaps this is a morning OPD that she has come to. Perhaps she is still feeling a little woozy because of the medication. Fortunately, he's changed it. But could it be because of those side effects of medications that she fell? And in fact, when she got up from the chair after seeing the doctor, she felt dizzy. Dizziness, giddiness, vertigo, these are all terms that we hear very commonly in our senior citizens. Right? So the question, why do older persons fall? Now let's follow this Mrs. X back to her house and have a look. This is Mrs. X standing in her room at home. And you see many things in this room. A lot of the A, B, C, D circles are around her, as you can see. Let me show you with my cursor. These are all circles around Mrs. X. But look at the floor. Look at things around the floor. Look at the small, cute dog over there under the table. Look at this table and what it has on it. Look at these lamps. They look like they were made in the 18th century. Look at this walker which is lying unattended and unused on the side. There are some stuff on the floor. The chair is perhaps having wheels on it. Now, all this gives us a clue as to why Mrs. X fell. Again, to address the question, why do older persons fall? Now, I'm going from Mrs. X to older persons in general. The first set of issues, the circles around Mrs. X, probably have to do with her. Probably she has visual problems. Probably she has hearing impairment. Maybe she has some muscle weakness, which is a normal thing as we age. A certain amount of muscle weakness is normal as we age. Maybe she has arthritis, a very, very common musculoskeletal problem in older people. And of late, she's having walking difficulty and unsteadiness. These are all possible reasons why older people fall. Then things related to her house and equipment. She is not using a stick or walker as she has been advised to. For some reason, she says, no, I'm not comfortable with it. She says, I'm not old enough. If you think you should walk it, you should use it, you go and use it. I'm not using a stick. I mean, that's for really old people. The floor could be slippery. Look at that rug which she has on her floor. It folds very easily, and a folded rug can cause you to trip. You know that. The floor is not exactly clear. There is clutter. And when I say clutter, I mean objects on the floor. That coupled with a visual problem, you know what it could lead to. Toys, perhaps, of children. Pets. Now, the pet is a great thing. I mean, please, I love animals. Doggies are beautiful. But there are times when a dog can interfere with your walking. Poor lighting in the house, maybe her room is not well lit, the bulb fused. She told somebody about it, but then it wasn't changed. Few days passed by, and unfortunately, the lighting wasn't enough, and she fell. Then some health related issues. Now, it is common for people when they get up from a sitting position to experience a slight dizziness. And that's because the blood pressure falls when you get up. It's normal. It happens to everybody. But for some people, especially when medications come into the picture and kind of stir the pot a little bit, that dizziness can become a little more than what is accepted as normal. Some medications themselves, like I said, medications which are, for example, sleeping medications. If you take it very late or you take a dose that is more than what you require, you can feel sleepy the next morning and perhaps in the first part of the day. And that can lead to unsteadiness and perhaps a fall. Neurologic disease, you know this, Parkinson's disease is a disease where people have difficulty in movement. They have tremors in their hands, find it difficult to grip something. And of course, dementia, which is a loss in the ability to think, remember, and relate with spatial objects. So these are all the reasons why older people can fall. There's a host of reasons, as you can see. So the next question is, what happens to older people when they fall? Now look at this graphic. It's a simple one. The good news in this graphic is that for about 13%, which is almost 1 in 7 or 1 in 8 people who fall, nothing of consequence happens. It's a mild fall, minor fall. They just fall, pick themselves up, and keep going on. But in a large segment, there is some injury. 62% of people, older people who fall, experience some level of injury. And in 25% or 1 in 4 of people who fall, unfortunately, that injury can lead to a broken bone, which is a serious thing. So what happens when an older person falls? Well, remember, we used the vignette of Mrs. X who had a fall. And let's try to trace after she had a fall. Supposing she had an injury or a fracture, God forbid, what happens to her thereafter? Now, for her, it could mean difficulty in moving about, difficulty in walking because there is an injury. It's difficult, it's painful when you put your leg down, perhaps. So because she is having difficulty in walking around, she develops what is known as a fear of falling. And fear of falling is a big risk factor for falling again. So she is scared that she will fall again. And as a result of being scared that she will fall again, she becomes more hesitant to walk around. And mobility becomes less. The moment mobility becomes less, muscle weakness increases. Muscle weakness increases, she finds it even more difficult to walk. And it's a vicious cycle. In fact, she can go as far as to become a little withdrawn, both physically and sometimes even mentally. Now, for Mrs. X's caregiver, it means that we are now going to encounter the healthcare industry. When you take her to get treatment for a fall and an injury or a fracture, that could mean a lot of expenditure. There's an economic consequence of a fall. Perhaps her level of independence comes down and we need to hire somebody to look after her. That is another big issue in itself. Who do we hire? How do we find a person? Who is that person? Is he or she a trustworthy person? How do we look after that person now who's going to be in our house? So many questions for the caregiver. And ultimately, all this may lead to Mrs. X requiring full-time care in a facility. So what happens when an older person falls? Many things can happen, even though the immediate consequence is an injury. But in the life of the caregiver and the older person, a fall can become a very important event. Right. Next question. What do we do when an older person falls? Now, again, I'm looking at it in two perspectives. One is, suppose you yourself fall, God forbid. The person who has fallen, their perspective, and the perspective of somebody at home who's looking after that person, what we call the caregiver or the bystander. So the person who has fallen, perspective first, don't panic. Now, I'm tempted to spend the next 5 minutes telling you about how we should not panic. Because I think panic and losing one's mental equilibrium is one of the worst things that happens when we have a fall. It's natural. I too had a fall recently from a bicycle. I mean, I use a bicycle to come to work some days of the week. And as I was going home, exiting from St. John's, I had a fall. I mean, I didn't see something on the road, or I tried to act funny, and the front wheel of the bicycle tripped, and I fell. And as soon as and you realize the utter helplessness you experience when you actually fall. I mean, it's all very well to pontificate about the definition of a fall, but when you actually fall, you realize how helpless you are. But the point is, when you have fallen, there is a sense of, oh my God, which happens. But it is then that we need to remember that it's okay. We don't need to panic. A fall is not necessarily a life-threatening thing. In fact, it is a life-threatening thing very little of the time. Mostly, it is not a life-threatening occurrence. So we must not panic, number one. Number two, we continue where we are. We don't immediately try to do something. We check ourselves gradually, face, neck, whether it's moving, arms, hands, our torso, whether we're able to turn, the hips and the legs. We check gingerly, seeing if we are okay. And then remember, the aim here is to try to get help. And that help could be a phone, a mobile phone. It could be a light switch if this is happening at night when we are on the way to the bathroom. It could be a chair, just to have something to hold on to and perhaps try to sit. And it could be, of course, another person. So the point is to try to get help. So we call out. We try our best to get attention. Now, how we get that help? We try to crawl to the nearest help point. Now here, if we are not able to, for whatever reason, when we have fallen, if something or the other is injured to the extent that we are not able to move, we mustn't try to crawl and precipitate something else. We shouldn't. We can remain in that position, keep calm, and continue to cry out for help or try to reach a phone or an object to make a noise to attract attention. We crawl if we find that we are not injured. Our legs are working, our feet are working, our hands are working, our arms are working. We try to crawl. In fact, on YouTube, if you Google, or rather search for the term first aid following a fall in an older person, you will see a few videos where the actual physical therapists tell you how you can move after you have fallen. In fact, they recommend that if it is possible, try to turn over and come on to fours, which means you're on your hands and on your knees. And in that position, try to slowly crawl to whatever point of help you can. All this is if you do not have an injury which precludes you moving. Now, for the bystander or caregiver, yes, like I said, the ultimate aim is to reach help. For the bystander or caregiver, again, don't panic. Many times, the caregiver gets more hassle than the person who has fallen, and that's not good at all. I, in fact, always tell whoever I can tell that whenever something adverse happens, always speak reassuringly. Be cool, be calm, speak reassuringly to them, right? And this is continuously. Whenever you speak, say, don't worry, we are here. Let's see what we can do. Call for help. Now remember, you're a caregiver. You can call for help, right? It could be a family member, could be a neighbor. And if it appears serious to you, call for healthcare help, an ambulance perhaps. As the person continues to lie down, if there is a tight belt or a cloth or something that has caught, loosen the clothes so that the person can breathe better, the blood circulation improves. Check for injury in, like I said, top to toe. Always remember, go top to toe. Face, neck, arms, hands, torso, hips, and legs. See if there is an injury. I mean, is there an obvious cut or a bruise or a wound or something like that? If the legs seem okay, any first aid involves raising the legs about a foot or two and putting a pillow or some support under them. Now, why do we do that? We do that to help the blood flow back into the central part of the body and the upper part of the body, which has the heart, to improve the circulation. That's why we raise the lower end of the body or the legs. If there is an injury or if there is bleeding happening, perhaps he's had a cut in the hand or the arm, compress the wound with a clean cloth. This is basic first aid for bleeding. And if you have access to ice or an ice pack, don't keep it on the wound, but around the wound, trying to lower the temperature reduces the blood flow there and reduces the bleeding, right? Now, if you're unable to move a limb or move the person, do not force movement. Let the person lie there while you reach for help. Now, this is what we should do when an older person falls. So, finally, how do we prevent falls in older persons? Now, this graphic shows you a guy who's mopping the floor with a mop while there is a basin full of water which is overflowing with the tap running in full flow. And what's written at the bottom is, we are too busy mopping the floor to turn off the tap. The saying, an ounce of prevention is worth a pound of cure, means that there is a scope to prevent falls. And it is said that at least a third of falls can be prevented. Not all falls can be prevented because, like, accidental falls which are caused when you trip and fall sometimes cannot be prevented. Okay. But at least 30% of falls can be prevented. And how do we do it? I'd like to present this in 4 domains. The domain of the home first, the domain of the bathroom, that's part of the home, no doubt, but it is a kind of a VIP place as far as falls and older persons are concerned. The domain of healthcare, and arguably the most important domain of lifestyle, diet, and physical activity. In the domain of the home, how do we prevent falls in older people? We should be careful with threshold and steps at home. The threshold is a sort of cultural icon in our rural areas. When you go to a rural household, even a semi-urban household, you will see a threshold at that where people enter the house. And while the threshold is a great thing to prevent perhaps rodents and other things entering the house when the door is shut, it's unfortunately a hazard for falls in older people. So careful with thresholds, careful with steps. Lighting, artificial lighting if necessary. Natural lighting is great. Non-slippery floors and handrails when necessary. Now, if we have small internal staircases in our house, we need to have handrails on them. No loose rugs on the floor. No clutter and wires. Now, rugs on the floor, I mean, to just toss a rug or two is an artistic element, perhaps. But when we have a senior citizen at home, those rugs can be dangerous, right? The bed and the chair of an older person must be of a height and of an accessibility which makes it easy to get on and off. And like I told you, while I'm all for animals, let's be careful with the way our pets come in our way when an older person walks. This is in the home. Specifically in the bathroom, older persons need to use the bathroom very frequently, many times. The bathroom needs to have an easy switch. We should not have a switch which is difficult to access. Now, the concept of grab rail means a bar or a rail which is at gripping height, perhaps all around the bathroom, especially near the commode, near the bathing area, wherever a person requires to hold. That's what we call a grab rail. No high shelves where we keep soaps and things, where we reach out and then we may trip and we may fall or we may experience imbalance. A non-slippery floor in the bathroom, a raised toilet seat, like you all perhaps know. We get attachment for toilet seats now, which we can put to toilet seats because it's difficult for older persons to rise from a very low toilet seat. And the bath mat and the bath rug follow the same rules as the rugs and mats at home. Be careful with them. In the healthcare domain, vision and hearing. We know that with passing of years, both our eyes and our ears start to kind of act funny. We need glasses. We need frequent change in glasses. We develop cataracts in our eyes, which need to be removed. And we develop a hearing impairment associated with old age. But all these things can be picked up early. Things can be done for them, like you obviously know. Review with your doctor regarding your medication list. Our senior citizens have very long lists of medications most of the time. And we need to consciously look at those lists and see what are those medications which are unnecessary, perhaps, which needn't be there, which might cause unsteadiness and dizziness. When you have joint pain or arthritis, let's see if we can do something about it, report about it, and see if something can be done. Depression. Now, 13 to 25% of older people can experience depression severe enough to cause concern. And depression itself leads to slower mobility, leads to impaired concentration, and can lead to a fall. Excessive forgetting is forgetting is something that happens all the time to all of us. So it's not something to be worried about. But when it is excessive and interferes with your activities of daily living, which means that you forgot what time of day it is. I mean, what is this? Is a toothbrush or what is a toothbrush? Things like that means that it has gone to the point where it is a concern. That is also a cause of fall. We need to pick up those things as early as possible. The feet, very, very important for us. Our mobility is largely determined by our feet. We must check our feet. We must see that our feet are okay. We must use footwear which is strong and good. Preferably covered on all sides, preferably with a good sole, not a slip-on thing which can slip off very easily when we least expect it to. On lifestyle, diet, and activity, the use of a stick, a walker, and an assistive device, I think must be something we need to rid ourselves of the stigma of. We shouldn't feel that just because we use a stick, people will laugh at us or we become embarrassed. We shouldn't feel that. If it is necessary, using a stick is far better than experiencing a fall. Physical activity of 30 minutes per day, ad nauseum, we tell this to our patients in both the rural and urban areas. I cannot overemphasize the importance of physical activity. I'm sure all of you are very keen on your morning walks. Please do it. Very, very important. And coronavirus, yes, of course, protect yourself. Don't go for walks in groups. Put on your mask. Keep a distance. Don't unnecessarily hug and shake hands. If you do all that, please walk every morning in the fresh air. Absolutely no problem. I'm sure many of you, if not all of you, are vaccinated. Exercises which strengthen muscles. Walking is great cardiovascular exercise, but we need, now look at that small picture. I mean, it's too small, I know, I'm sorry. But that picture shows you an elderly lady who's using dumbbells. Now, why would she do that? She's doing that because she wants to increase the muscle strength in her upper limbs. The lower limbs also. Muscle strength is a very, very important determinant of how easy it is to fall. So we need to have once or twice a week at least our muscle strengthening exercises. Now, exercises for balance. There is this called Tai Chi. I'm sure all of you have heard. I don't know if Silver Talkies has had sessions of this. I personally haven't tried Tai Chi. I've had a demonstration of it once or twice. I've seen it and I've filed it away at the back of my mind that I need to do this, but I really need to get down to doing it. I think all of us would benefit with exercises for balance. Physiotherapists are very important people. VIPs for the senior citizen are physiotherapists. I think we need to have a close relationship with physical therapists as we grow older. Smoking and alcohol, less said the better. Tobacco is an absolute no-no. Alcohol, well, try to moderate quantities of alcohol. Low-risk drinking is what we are aiming for if you are in the habit of having a drink. Definitely not high-risk drinking. Calcium and vitamin D don't prevent you from falling, but they build up muscle strength. So the consequences of a fall, I mean bone strength, the consequences of a fall can be a little better if your calcium and vitamin D are at good levels. So with that, I've come to the end of what I wanted to say today. Just to recap, these are the questions we asked. What is a fall? You saw that gentleman who was walking and inadvertently, suddenly, he came to rest at a lower level. And that's a fall. Why do elders fall? We saw a host of reasons why elders can fall. What can happen when an older person falls? In the best of situations, nothing. But unfortunately, injury does happen to quite a large proportion of elders who fall. But fortunately, not all of that injury means a broken bone. Only about 1 in 4 or 1 in 5 will have a broken bone. Now, what should we do when an older person falls? We looked at it at two perspectives, the perspective of the person and the perspective of the caregiver or a bystander, right? And finally, how do we prevent falls from 4 domains? The domain of the home, the domain of the bathroom, specifically in the home, the domain of healthcare, and the domain of lifestyle and our physical activity. With that, I will say thank you at this point, but open it out to Nidhi. Back to you, Nidhi, for the questions that people might have.
Thank you so much, Doctor, for that. I think you pretty much covered everything. In fact, most of the questions which came in the chat box, your presentation later covered all of it. So it was really brilliant. I just have a question or two of my own before I get into a few other questions which are there from the participants. I just wanted to check. So I understand there is something called a gait assessment, which is done to kind of assess how prone an individual can be to fall. Is that something which is done for seniors specifically?
Yes.
Can you tell us a little bit about that?
Yeah, sure. Gait assessment is part of what we call a comprehensive geriatric assessment. A comprehensive geriatric assessment simply means that we look at an older person from top to toe physically. We also look at other domains like the social domain, the domain of function, the mental domain, and many other domains. One of the domains that we look at is the functional domain. And one of the parts of the functional domain is the ability to walk, which is gait assessment. Gait is the name for walking. So the assessment of gait, which leads on to what we call the assessment for fall risk. So how do we do gait assessment? We have a few tests which we do. One of them, for example, just to share with you, not that I'm suggesting that all of you try it for yourselves, don't. But one of the tests that we do is called a timed up and go test. We ask an older person to sit at a point. We draw a line 10 feet away. And on the count of 3, we ask the older person, get up, walk to that line, turn around, walk back to your chair and sit down. And we see how long the older person takes to do that. We have cutoffs for that. And if the older person takes beyond the cutoff time, we say that the gait is slow and the falls risk starts to increase. So in short answer to your question, yes, gait assessment is a part of comprehensive assessment of an older person. And this is one example of a test for gait assessment. Yes, Nidhi.
Okay, thank you. The other common issue that I have observed or I've heard of is that I think as a person ages, sometimes walking is where they are probably dragging their feet. They are not able to, walk properly one foot after the other kind of a thing, right? Specifically, if somebody is facing that kind of a situation, what is the advice you give to them? How can they manage their day-to-day walking?
Well, like I said, as we grow older, our gait speed reduces. I mean, the speed with which we walk comes down. And in addition to that, if we experience other health related issues, for example, a person with diabetes could have a neurological problem, nerve related problem with the feet, where he or she feels the feet tingling and kind of burning and a reduced sensation on the bottom of the feet. These are all problems related to the nerves, which happen when you have diseases as you age. So for all these reasons, yes, people could, for example, drag their feet. For example, need to lift their feet higher than normal because the foot drops. It doesn't kind of come on to a level like this, but it drops. So when you lift your foot, you have to lift it even more to be able to walk ahead. Now, these are issues with gait, Nidhi. And I think that a gait assessment by a good physical therapist is something that I would recommend for all older persons. Physical therapists are trained to see what the issues with gait are. Some gait problems can be improved by muscle strengthening exercise. Some gait issues can be improved by assistive devices like a cane or a walker or a three-prong cane or a four-prong cane. There are so many possibilities for solutions when there is a gait-related issue. So in short, I would say that yes, that kind of a gait which you described, where people drag their feet, is something that can happen due to a host of reasons. I would recommend a physical therapist to look into it, see what exactly the problem is, and prescribe the required solution, which could be a assistive device, or if required, refer to healthcare for maybe the sugars are not controlled, or something requires to be done there, or something like that. Yes, Nidhi.
Now, there was one very other important point that you had spoken about, the general stigma that people have around using a walking stick, right? And I've had this scenarios where the children feel that their parent can use a stick, but the parent is not ready because they feel they don't need it, right? You spoke about it. Are there any signs that you can speak about that, which one should be aware of and feel, that this is the time, yeah, I can consider using a stick, right? Are there any signs that one should look out for?
I don't know. I mean, I wouldn't say I can put a finger on a sign which says that if you have this, you should use a stick. But I would say that if I ever experienced unsteadiness in any way, in normally walking around the house, which is perceived by me or a caregiver, even somebody living at home may say, listen, I don't think you're very steady. The way you got up and walked just now, you're a little unsteady. And many times I'm going on saying, just hold me for a moment. I'm just going to get up. Yeah, yeah. No, don't leave, don't leave. Yeah, now you can leave. Now, when I do things like that, that means there is a steadiness issue here. Now, that calls for two things. One is an assessment. Why am I unsteady? I mean, there are reasons why people are unsteady. If we can get to the bottom of it, for example, it's a balance thing to do with the inner ear, for example. Perhaps an ENT assessment followed by something which will take care of a mild vertigo issue, which can be probably treated, then that unsteadiness may go away, and in which case I'm fine. But if it doesn't go away, and even after assessment, it is deemed that no, this unsteadiness, we are not able to put a finger on it, it's probably because slowly there is a muscle weakness and a balance issue. we think you need a walker or a stick, not a walker, at least a stick. So I would go, Nidhi, by not saying that there's a particular sign, but I would take feedback from myself and the caregivers around me to be sensitive to the fact that I need assistance when I walk. And I I would appeal to everybody here in this audience. I know that there are a lot of seniors in our audience today. I would appeal to you to please tell all your friends, all your colleagues who are your age or older, to cast away any reservations they may have about using a stick or a walker, because it's miles better than experiencing a fall. Really, for people who see the other end of the spectrum of people who have fallen and what happens thereafter, I can assure you that using a stick is a very small price to pay. Yes, Nidhi.
A very, very important point. Another thing, I remember when I was visiting a therapist, he happened to mention that walking barefoot is actually a better thing to do than be walking in a footwear and risking the, slipping off in a footwear. So what are your thoughts on that? Is walking barefoot a better idea? It's at least inside the house.
Well, I wouldn't necessarily agree, because walking barefoot when you've got issues with your sensation in the foot and things like that can prove to be a hazard, number one. Number two, it depends upon what people are used to. Now, if you're not used to walking barefoot, walking bare feet is very uncomfortable and is not pleasant at all. So there is no blanket rule here, Vidhi, where I can say that walking bare feet is better or worse. No, it depends entirely upon the person, how they are comfortable, what they're comfortable with doing, and the least risk for fall and the best gait achieved. For many people inside the house, they do need a nice, solid rubber soled footwear. They do need it, and it's very useful for them. It's non slippery, doesn't slip at all, and it's great to use. So there is no blanket rule favoring either bare feet or no bare feet.
You had mentioned about Tai Chi and doing balance exercises. So we haven't really, offered Tai Chi in our forum as yet, but we are, we've looked at it and we still to work it out. But we do work with a couple of physiotherapists who run this fitness program specifically designed for seniors, which is a combination of different therapies, starting from yoga to a little bit of aerobics, and so it's done by two very professional physiotherapists who've been working with seniors for 15 years. So I just wanted to let everybody know that we do have a program like that available at Silver Talkies in case anybody is interested. Now, one of the questions which came in the audience was specifically around, they asked any particular precautions to be taken by cardiac surgery patients.
Okay, well, cardiac surgery has its own physiotherapy recommendations following surgery. Usually, cardiac surgery, the moment the surgery is finished, focuses on physiotherapy to restore the functioning of the lungs and the chest. That's what the focus is on. But older persons who undergo any form of surgery, including cardiac surgery, in willy-nilly have long periods where they are bedridden or they are in bed for long periods of time. Now, when an older person is in bed for a long period of time, that older person's muscles immediately start to become weak. And following cardiac surgery, the need for physical therapy to get back your level of functioning, physical functioning, to be able to get up, walk, do your activities of basic activities of daily living is very, very important. So the question is, are there any special precautions? I would just say that following any surgery, including cardiac surgery, no special precautions, but ensure that you have a very good physical therapy consult and prescription before you leave that hospital, because they need to put it into you the importance of regaining whatever muscle strength you have lost because of the period of bed rest that you have mandatorily had following surgery. I'll stop there.
Okay. The other question which came up, since you spoke about foot health under the healthcare segment, the domain, can you suggest a suitable checkup which is exclusively for the feet?
Well, we talk to our students all the time about foot care and what the steps involved in foot care are. So let me share a few things which everybody can do.
Mm-hmm.
What we recommend to all our older persons, especially those with diabetes and those who have other issues relating to the nerves, for example, is that first they should keep their feet clean, which means that they should wash their feet with soap and water. And in this sanitized era of sanitizers, let me remind everybody that soap and water is the way to go. Even when you clean your hands, when you use soap and water, you get clean hands. When you use a sanitizer, you get sterile hands. And there is a difference. So, soap and water is the go to thing. We wash our feet with soap and water at least twice a day, morning and night. We look at our feet and examine our feet. And how do we do that? Well, for an older person to look at a foot is sometimes difficult because you can't bend all the way to look at the foot closely. And the foot is pretty far away when you're up there, and the foot is at the bed, I mean at the foot end of the bed. It's difficult to lean and look at the foot. So have somebody else look at the feet for you if possible. We also recommend to look at the sole side of the foot, to actually place a mirror on the sole side of the foot and see the reflection of the foot in the mirror, which will show you what is there behind, what you can't see. The sole of the foot, especially for an older person, to turn the sole and look at the sole is difficult. So examination of the foot, cleaning of the foot is the starting point. But what we are really looking for are any small injuries, any small wounds, the areas between the toes of the feet, anything there which has, it could be a whitish kind of an itchy patch to start with and then breaks down into a wound, right? So care of the feet involves at least these three things: keeping them clean, examining them, looking for the presence of any wound, any lesion on the bottom or the top of the feet, between the toes. Now, when you cut the nails, we must be very careful. We mustn't, in our enthusiasm to do a good job so that we won't have to cut it again for a long time, we go ahead and cut the nail very deep. Now, that can lead to an injury. At the same time, we shouldn't allow our nails to grow too long. So care of the nails also as part of general hygiene of the foot is very important. Now, the footwear that we use is also important. It should be correctly fitting. If there is a tendency that the foot is being bitten on the extremes, on the sides of the feet, we should discard that footwear and not be attached to it for a sentimental reason. I love this shoe. It's been with me for the past 12 years or whatever. It bites me, but it's okay. No, it's not okay. A shoe which bites after 10 years needs to be discarded and replaced. Is an important part uh, of care to avoid falls. Yes, Nidhi, back to you.
Okay. You've been speaking about good footwear. Dr. Pushpa actually wanted you to kind of elaborate a little bit more on, how do you kind of define a good footwear?
Wants me to elaborate on what is good footwear. Okay, I think good footwear is something that has a firm sole going from bottom up, a firm sole which is probably made of rubber or some other firm material which doesn't slip when you try it out and you push it with your foot. The floor should offer some resistance. It shouldn't go very smoothly on the floor. It should be covered ideally. This is to protect you from anything that may poke from the side, dust, dirt, and other things. There are footwear with straps and footwear without straps. I somehow feel that if the strap is comfortable and doesn't injure you, a footwear with a strap is a good idea for an older person to use. And the softness of the sole of the foot, of the shoe, that there are soft soles available now. We used to have a material called microcellular rubber, which basically is not only soft and comfortable to use, but also evenly distributes the weight when you stand, and therefore doesn't put too much weight on any one part of the foot, which could lead to an injury on that part. So I think these would be some of the features of good footwear. Okay, these would probably be some of the elements of good footwear that we talk to our seniors about.
Okay, cool. Uh, then there's a question which Mr. Uma Shankar has asked. Should older persons not move alone? Should they always be accompanied by someone?
Should older persons not move alone? Well, I would guess again. I think it's fair to say, even looking at the composition of this group, that older person is not a homogeneous term. I mean, there are older persons and there are older persons. There are people at the age of 50 and 35 who sometimes look like the world is on their shoulders. And there are people aged 75 and 80 who look like some of you who are chirpy and bright and feel the world is a great place. So just like that, I wouldn't say that it's a blanket statement that an older person should not go alone or can go alone. It really depends upon the situation, the circumstances of the older person. But I would say this, that if there is the slightest doubt in the mind of an older person that he or she feels a little unsteady or a little lacking in confidence in making a walk outside the house or on the pavement or on a footpath, then that person should have assistance. That person should not feel shy to say, hey, listen, can you just help me across the road here? Or something like that to somebody who's close by. I think that freedom should come in an older person's mind. So I wouldn't answer yes or no to that, but I would qualify it by saying that I leave it to you, sir. If you think that you have the slightest doubt, I would suggest asking for help. Remember, using a stick, asking for help, leaning on somebody is better than having a fall. Yes, Nidhi.
Do old injuries incurred during childhood or adulthood increase the vulnerability? Any special care that should be taken?
Yeah, the consequence of older injuries, generally, an old injury, is perhaps something which restricts the range of movement in a joint. Now, for example, let's say I've had a fall and I've had my hip joint operated upon. Maybe there's a nail or a screw put into the bone there. And now, after I have been rehabilitated, good physical therapy, I've achieved my functional ability. But I know that whereas I could probably move my foot on a range of about 105 degrees before the accident, before the fall, or before the injury, now that has been reduced to maybe 90% or 85%, I mean 85 degrees, the range of movement. So to that extent, that an older injury restricts your range of movement of a joint or of a limb, it does probably increase the chances of fall by a small extent. But not just because there has been an injury. Unless that injury has this consequence of a reduced range of motion, it should not affect your chances of fall. In other words, let's say there's been an injury to the hip, there's been a wonderful surgery, great physiotherapy, and I'm back to what I was before. Range of movement is the same. Wonderful. I thank the Lord and say my risk of fall is not increased even by 1%. I'm fine. I'm good.
Important differentiation. Yeah. Since we spoke about dizziness and vertigo, somebody wants to know, how do you deal with dizziness and vertigo?
Well, dizziness and vertigo is a huge chunk of geriatric medicine because there are many reasons why dizziness or vertigo should happen. Like I said, the very basic and commonest cause of dizziness or vertigo is when a person stands up from a sitting position and suddenly finds himself a little woozy for a few seconds. I'm sure all of you, many of you have experienced that. Even I experienced that. Because it's a normal reaction of the body that when you suddenly get up, the blood redistributes, the blood pressure falls transiently. But the body is such a fantastic thing, and I can never get tired of extolling the virtues of this wonderful human body that we have. That sensors placed all over the body immediately alert the whole system, saying that, hey, 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 blood pressure is falling. And immediately the heart pumps a little more, blood pressure comes up, you're fine. Now, this happens imperceptibly to most of us. But as we grow older, that reflex kicks in a little later. And that's one of the causes why people may experience dizziness as soon as they get up, which lasts for a little longer. But that being said, there are many other causes of dizziness. It could be a neurological cause. It could be a balance cause. It could be, related to the inner ear and balance. It could be a visual thing, that there is something wrong with my visual field, and there is a certain unsteadiness that I'm experiencing because of my vision. It could be a heart related thing where the heart has a rhythm of pumping, and when it doesn't pump in that rhythm, and that rhythm kicks in a slightly different beat, we call it an arrhythmia, which is a fancy term for what I just said. That could cause an episode of dizziness sometimes. So there are many reasons why dizziness should happen. But if somebody experiences dizziness, my suggestion is that they require an assessment. They require to go and ask the question, report to a doctor and say, excuse me, I'm feeling dizzy. And the guy needs to have a look at him top to bottom and see what the cause is. So I wouldn't say I would be able to answer the question, what do we do for dizziness? But we really need a comprehensive evaluation of why that dizziness happened. Suffice to say that there are many causes, many of which are treatable, which means that the dizziness can improve. Yes, Nidhi.
Okay. How good is yoga for improving balance?
From hearsay, I don't practice yoga. It's a confession. I'd love to, but I don't practice it how much I probably would like to or should. But yoga, the physical part of yoga, no. If you get me started on yoga and what it means to the mind and body, etc., yoga is actually a very comprehensive science which has a lot of mind in it as well. But the physical part, the asanas in yoga are said to improve muscle tone and balance. Now, improving muscle tone and balance is a great way of preventing falls. So if yoga does that, and I believe it does, I would prescribe it unhesitatingly with adequate supervision. Yes, Nidhi.
Yeah. So now this is a question related to something which you spoke about with regards to foot health. What is the solution or treatment for burning and tingling feet?
Burning and tingling feet is a common symptom of people who have what we call neuropathy, which means pathy means a disorder, neuro means of the nerve. So the neuropathy associated with diabetes is a very common cause why people have tingling and burning of the feet. But that said, there are other causes for why tingling and burning can happen apart from diabetic associated neuropathy. So what does a person do when a person experiences that? Well, we have some therapies. We do have some medications. We do have something to offer for neuropathic pain or neuropathic sensations, which we prescribe our patients with diabetes. And many of them do well on those therapies. So I would say that what do you do for that kind of a thing? There are therapies available, tablets available, drugs available, which can reduce neuropathic symptoms. And whoever your primary care physician is, I would suggest checking out with them as to what you could do for that. We do treat our patients with different drugs.
This is more around a psychological, kind of question. It says how to deal with indifference on part of seniors when we enlighten them about their plight and that they require full-time care.
This is where I'm reminded of this thing which people keep saying, which is that elders are just like children. Well, they're not, and we know that. All the elders here also know that, because you all are so experienced with your own 60 plus years of life. You've got all that behind you. And obviously, when we deal with an older person, we are dealing with somebody who has experience. We are dealing with somebody who knows a lot of things already. And therefore, when we tell that older person something, saying that, don't do this, you shouldn't do this, it's not like talking to a child at all, because it is actually talking to somebody who knows a lot, who's been through a lot. And that somebody is very tempted to tell you straight off, look, you don't need to tell me this. I know better than you. Now, this is the natural response of somebody who's had 65, 70 plus years of experience. So therefore, how do we reach out to the mind of an older person? The principle is the same as we deal with students, perhaps, which is we need that older person to feel that he or she needs to do this. It is only then that they will do it. They will not do it because you have told them to do it. They will do it because they feel that they need to do it. Now, how do you convert this to that? Now, if I had a 2 minute way of solving that problem, I'd be very interested to know, really. It's not easy at all. But I would think that our role as caregivers is to present information in the best way we can, is to present credible information and say, look, I have read here, or this book says this, or this so and so said this, that using a stick reduces risk of fall by almost 20-30%. You, I didn't say it. I mean, it is said by people who know, people who see. So I'm offering you this stick, and I really think that you should use it. You should consider using it. But the decision is yours, really. Now, this is possible in a dispassionate situation of a doctor-patient, but it gets very difficult in a family situation. Even I don't talk, I don't know, my mother also said that she would probably try to join, but I don't know if she's part of this. But if she is, she knows I don't talk like this with her. I say, no, you listen, you do this, and you don't do this, and you do this, and you don't. And her tendency is to probably say, listen, I know also, and the whole 22 yards. So, Nidhi, in short answer, I think our responsibility, if we want to present information to senior citizens, is to present it credibly, simply, and in a way that they must consider using it themselves, and not because we said that they should do it. I'll stop there.
In fact, there's another question along similar lines from the same person who wants, I think she's a caregiver. She says, is it good to relocate senior citizens to a ground floor place? Will they be mentally affected if they are shifted from their home of many years, even if it's for their health to improve?
Well, research shows that a familiar environment is a very important part of a senior citizen's life. So if moving a person from a third floor or a 15th floor to a ground floor means, I mean, the cost benefit ratio of this means that the benefit obviously is that, okay, they're not in a high floor and one or two elements of injury of height and railing and balcony and all are not there. They're in a ground floor where they can look around and they're grounded. That's the benefit. But if the cost is that uprooting a person of 15 years, etc., and putting them in an unfamiliar environment where they themselves say, listen, I am not happy here and I'd like to get back there. That is my place. I think we have to pay attention to that, because one of the risk factors for cognitive decline is an unfamiliar environment. When there is early cognitive decline and you keep changing the environment, that cognitive decline progresses a little faster. So I think paying attention to what a person asks for in terms of a familiar environment is a very important thing.
Is it good to use diapers at night if the senior is unable to visit the toilet at night due to movement restrictions?
Yes, I think it is good. If the option is frequently visiting a bathroom and sometimes being incontinent on the way to the bathroom, being uncomfortable in any way, feeling embarrassed that they have lost urine or stool when they didn't want to, all these issues, if wearing a diaper removes these problems, I'm all for wearing a diaper. And I think that we should recommend that our seniors consider wearing diapers if it removes these problems of frequently needing to get up in the night and going to the bathroom, which is a high risk activity for a fall, and maybe even losing urine or stool when they don't want to, which is called incontinence, which leads to embarrassment, which leads to a great deal of discomfort, and also physical illness, I mean, infections and a lot of other things. So all this, if a diaper takes care of, diaper at night, I think that is another stigma that we need to remove from our minds of wearing an adult diaper. So I think that anybody who has these conditions must consider the use of an adult diaper.
How do we overcome cramps on the feet at night?
Yeah, cramping in the feet is a very common symptom in our older persons, and I'm almost borderline ashamed to say we don't have the ready-made solutions for cramping that happens in our senior citizens. We try a lot of empiric therapies. We say, why would there be cramps? I mean, if it is because of dehydration, for example, are you drinking enough water during the day? Now, this is again not to say that seniors should drink a lot of water after 6 p.m., which means that again, the nighttime problems start. So keep yourself well hydrated up to 6 p.m. at least during the day is one solution for cramping. The other is we use a vitamin supplement called, which has vitamin E in it, called Evion. I'm sure many of you are familiar with Evion. It's an over-the-counter medication, so I'm comfortable discussing the name of the drug on a forum like this. So Evion 400 is something that we prescribe to our patients who complain of cramps. Not all of them get relief by Evion, but some of them do. And one of the muscles that cramps up at night is the calf muscle, the sort of bulky guy at the back of the calf. And that typically happens. Now, assume that this is the foot. If you can see the screen, this is the foot at night. This is the foot itself. These are the toes. Now, many times when an older person is asleep or when anybody is asleep, they stretch the feet this way. Now, when you stretch the feet this way towards the outer, the sole of the foot, what they're doing is actually this muscle at the bottom, this is the calf muscle, is contracting and pulling the foot like that, and you're stretching. That's what we all do when we stretch our feet straight, the toes straight. Now, when that happens at night, and excessively so, this muscle of the calf can cramp up and become very painful indeed for almost half a minute or so. I'm sure many of you have experienced this. Now, the first aid that we recommend for that is to try to grip the foot and press it towards you. Pull it towards you. You can hook your finger on the big toe and pull it towards you. So what you will do when you do that is you are pulling, stretching the muscle in the other way. I mean, you're contracting this muscle, and this one gets a little relaxed. So that sometimes stops the cramp and offers relief at night. I mean, this is just a simple first aid for a calf cramp, but many people get finger cramps and toe cramps and all kinds of cramps, for which, like I said, we don't have too many answers. It could be this nutritional supplement, like I said, could help. Hydration could help, but I'll stop there.
So a follow-up question to that that just came up was, do you recommend magnesium supplements for cramps?
Yeah, I know there are these supplements, both calcium and magnesium supplements, which we recommend. Calcium definitely, especially for older ladies. After the age of 60, it's a good thing to have a calcium supplement every day. Magnesium supplements, I know, have been in the news recently. I haven't seen research which links them to cramping. I haven't seen. So I'm not able to say definitively whether magnesium supplementation improves cramping.
And actually, that was the last question I had. In fact, we are getting a lot of messages where everybody is really appreciated your presentation and what you spoke about, and the very, the specific, finer, the smaller practical aspects of how to prevent falls that you highlighted. I think that was really, really helpful. So thank you so much, Dr. Kasthuri. It was a pleasure and honor having you here. I think we have kind of answered everybody's questions. Everybody's just sending us messages of appreciation. So thank you so much for this.
Thank you very much, Nidhi. Thank you, ladies and gentlemen who have been on this session. I do hope that something somewhere helps somebody from falling. Right? Thank you very much. God bless you. Have a lovely evening.